All right, today we're going to tackle a really common and, let's be honest, kind of scary medical mystery that happens right under our skin.
You know that feeling, right? You're just going about your day and then you feel it. A tender, weird little bump that definitely wasn't there yesterday. And your mind just starts racing. What on earth is this? Is it bad? That's exactly what we're going to get into.
So, we're going to pull back the curtain on these lumps, because figuring out what's actually going on is always the first step to knowing what to do about it.
Now, when you find one of these things, it almost always comes down to two main suspects, a cyst or an abscess. They can seem pretty similar at first, but trust me, they are fundamentally different. So first up, let's talk about the cyst. The easiest way to think about it is like a tiny self-contained pouch that's formed under your skin. It's a structure. The cells that make up that little sac are different from everything around them. Cysts usually take their sweet time, growing slowly over weeks or even months. And most of the time, they don't hurt at all unless they get really big or irritated. An abscess, though, that's a whole different story. It's not a structure, it's an event. It's basically your body going to war against a bacterial invasion. Your immune system rushes white blood cells to the scene to fight the germs, and this painful, inflamed pocket of pus is the battlefield. That's why an abscess usually feels tender and warm and can sometimes make you feel kind of sick all over.
So here's the absolute most important takeaway. A cyst is a thing. It's a little enclosed bag that might just sit there doing nothing. An abscess, on the other hand, is an active infection. It's a battle happening inside your body right now. Getting that difference is key to everything else.
Okay, so let's put them side by side. A cyst is usually caused by something simple, like a blocked gland. It grows slowly, feels pretty smooth, and is typically painless. An abscess, though, that's a bacterial infection, very often staph, and it shows up fast. It hurts, it's warm to the touch, it's red and swollen, and sometimes you can even see that little head where the pus is collecting.
So why do we care so much about telling them apart? Because with an abscess, we are talking about an active infection. And infections, well, they can get pretty dangerous if you don't handle them the right way.
The number one culprit behind these infections is a bacterium called Staphylococcus aureus. You've probably heard it called staph. And here's where it gets really serious. Some types of staph, like MRSA, have become resistant to our go-to antibiotics, which makes fighting the infection a whole lot more complicated.
And some people are just more likely to get these. If you have a weakened immune system, or a condition like diabetes, or even just a tiny nick from shaving, that can be all the invitation bacteria need to set up shop.
All right, this is the million-dollar question, isn't it? When does this painful lump cross the line from just being annoying to being a real medical issue that needs a doctor's help, like right now?
Okay, these are the red flags. Pay close attention. If you get a fever along with the lump, or if you see the redness around it spreading fast, that means the infection is on the move. And if you see red streaks coming off of it, that's a huge warning sign the infection could be spreading through your system. Severe pain, a lump bigger than about half an inch, all of these are your cue to pick up the phone and call a doctor immediately.
Okay, so you know what you're looking at and you know the serious warning signs. What's the plan? Let's talk about the do's and the really, really important don'ts.
This is the number one golden, unbreakable rule. I know how tempting it is, but trying to squeeze or pop an abscess yourself is one of the worst things you can do. You can accidentally push all that infected gunk deeper into your body, making things so much worse. You could even push bacteria into your bloodstream, which can lead to a life-threatening condition called sepsis. So please, just don't.
So if you can't squeeze it, what can you do? The safest bet at home is to just support your body's healing process. Applying a warm compress can help bring more blood flow to the area, which helps fight the infection and might encourage it to drain on its own, safely. Besides that, just keep the area clean, keep it covered with a bandage, and wash your hands. But remember, you're doing all this while keeping a close eye out for any of those red flags we just talked about.
Now, if an abscess needs a real intervention, this is how it's done right. A doctor performs a procedure called an incision and drainage, or IND. They'll numb the area completely, make a tiny clean cut, and let all that pus drain out. It gets rid of the source of the pain and is the critical first step to clearing up the infection for good. All right, we have covered a lot of ground. So let's just boil it all down to the most important things that you need to take away from all this.
If you only remember one thing from this whole explainer, please let it be this. A cyst is a structure. An abscess is an infection. That one simple fact should guide every single decision you make, from should I wait and see to should I call the doctor.
So here's your final cheat sheet. Know the difference, structure versus infection. Recognize those red flags, heat, spreading redness, fever. Never, ever, ever try to pop it yourself. And understand that while warm compresses at home are helpful, the real treatment for a stubborn abscess is professional drainage by a doctor.
At the end of the day, that lump under your skin is a signal. It's your body trying to tell you something. Learning how to read those signals, to tell the difference between a quiet little structure and an active infection, that's a really powerful skill. It gives you the power to take the right action at the right time for your own health.
Ah!